Hi, everyone. Welcome back to the Women and Rheumatic Health Invisible Battles series. We're thrilled to be here as we were. This is our second episode. This one is called Doc, My Joints Are Achy. And we're going to get into that in a bit. The series overall is looking at women and rheumatic health, just exactly the name of it. Often women are fighting invisible battles. And what we're trying to do is demystify it for the audience, for caregivers, advocates, and patients, as well as the healthcare provider community. And so we're thrilled. Katie and I are thrilled. By the way, I'm Todd Keats, founder, CEO of My Care Friends. And Katie is Vice President of Programming and Community for My Care Friends. And we are thrilled to collaborate on this program with Dr. Michelle Koolaee. And so this episode is about understanding when joint pain is just pain versus disease related. And there's some important distinctions that we're going to leave for Dr. Koolaee to get into. So let's start with talking about the pain puzzle, as we might. So Katie, do you want to start with that?
Absolutely. Great. Thanks so much, Todd. Back to the pain puzzle. I'd love to start with a dilemma that many women face. We're already managing if we have a rheumatic condition, that particular condition, but now every ache or pain makes them wonder, is this a flare or something else? Could you speak to that a little bit?
I'd love to. Thank you, Todd. Thank you, Katie, for having me here. It's always a treat. I think that, when someone comes into the office, when they complain, my joints hurt, yes, it could be arthritic, a joint problem. And when I think about arthritis, I think, is it inflammatory arthritis related to autoimmune disease? Is it regular age-related wear and tear arthritis? The other category is it not even arthritic? Is it a muscle pain, muscle issue, such as fibromyalgia? The other category, is it an orthopedic issue like a tendonitis or a bursitis? And so I think it's important, even in someone that has an known autoimmune disease, is to make sure that you're partnered with somebody that you trust, a rheumatologist or otherwise, that can help in understanding what are the cause or causes of your symptoms, because that helps to make sure that you are on the right path as far as treatment. Because it is tempting in someone that has, that I saw yesterday, for example, that has really bad rheumatoid arthritis. Her joints are wildly inflamed as I'm seeing them. That she also has an element of muscular pain. She has fibromyalgia. So it's not every single ache and pain is necessarily related to the autoimmune disease. And we have to remind ourselves of that every visit. And so, and it's every person is different. So like we have personalized discussions, and I try and empower people so that they can help, and they know their body best, but to make sure that they have the right tools to know, okay, like how do I determine what's inflammation and otherwise? And part of it is hard, and that's why we meet regularly and continue to have an open dialogue about symptoms.
Great.
Absolutely. That actually reminds me, it makes me think of my mom, who, if the audience
Mhm,
doesn't know my story, my mom has systemic scleroderma, an autoimmune
mhm,
disease. And so to your point, she's always wondering,
Mm,
are the pains that she's having, are they related to the scleroderma? Are they muscular? Where
mhm,
are they emanating from? And then it's hard to determine. And
mhm,
so it's very hard for what do you suggest for like a patient like that, like my mom?
mhm.
What do they do? Because it's always, do I call the rheumatologist? Do I call my primary? Do I just take Tylenol?
Yeah, I know these are all important, a very important topic and something that comes up every single day, multiple times a day. Because number one, even regular run-of-the-mill aches and pains, osteoarthritis, muscle pain, sometimes that pain is so severe, it brings people to the ER. Even just bad muscle strain it's so severe, it brings people to the ER.
Mm.
So I think that it is hard in knowing how do I navigate and who do I call and how do I proceed. And and I think just some general things to know. And again, obviously these are just kind of overarching themes. But obviously, if any pain is severe, excruciating, it's important to go to whether it's an urgent care or ER to get it checked out. Because what if it's not, what if it is something serious, for example? And so that's always going to be an important thing to know. Number two is that if you have access and support, and like my practice, the structure is that if someone's flaring, you can text me, you can message me. It is, and I don't want it to wait. It should not wait. The sooner we know, the sooner we can kind of come up with a plan together. But that's not the case majority of the time. It is like, okay, who do I contact? What time? Um, and I think ultimately that is when you're in the appointment with your doctor, is saying, hey, what is our plan if this flares? And try and come up with a plan of action ahead of time as much as possible, right? And that's hard. But it's good to try and plan that so that like, okay, what do I do if my pain is mild to moderate? And what do I take? What do I do if my pain's moderate to severe? What do I take? And try and kind of get some workflows and that take some organization ahead of time, so that because it's a really awful feeling being stuck and like having some excruciating symptom and then being like, okay, now I'm like really anxious of like, what do I do? And who do I call? But it's hard. I think that those scenarios are difficult.
Yeah.
Yeah, yeah. So the last point related to this pain puzzle for today,
Oh,
can you talk about the importance of everything you just said in terms of addressing it related to mental health? Because mental health is a huge, huge part of any disease. It's certain
Mhm.
diseases that present in different ways, multiple ways.
Yeah, I think the mental health part is so critical. I mean, so critical. Imagine these diseases, it's like a roller coaster ride where there's so much going on that's out of one's control. Planning, I mean, just stress in many levels. Your body's not cooperating. Sleep is disrupted. So inevitably mental health, it's a scenario where it can take a toll. And so I think and I always tell people, and I think this, I sincerely believe this is the most important, is making sure you are mentally good, you're mentally strong, and staying mentally healthy. Because if you can maintain a healthy mindset, and which can involve changing the entire lens that you're viewing life and health and progress, but that's doable. But if you can
yeah.
do that, um, and keep your mental health good and do work within your means of what your body allows you to do, redefine what is progress. That is key because if you are mentally well, then everything else is okay. But if your mental health goes, then your body's gonna follow after suit.
Yeah.
So yeah, and so I think that it is not, one should not feel that they have to do that on their own. Find support, whether it's professionals, therapists, rheumatologists, trusted people in your life. Develop a community for yourself where you're surrounded by good and you're surrounded by people that uplift you. And sometimes in conversations that I've had with other friends with rheumatic diseases, but also patients, sometimes that might involve setting boundaries and people that don't serve you and are not uplifting you and keeping you in that good spirit, then they can't be, you kind of have to create that boundary. And so that your health comes first,
Yeah.
and that's what's important.
Yeah, definitely. I'm going to keep going and then I'll hand it back over to Katie. But there's a we'll call this the moving target challenge. It's like,
Mhm.
and you've led into this with what you were just talking about it, coping strategies when pain patterns are constantly changing. And, how does somebody address the frustration of unpredictable symptoms?
It's really hard. I mean, I think the scenario I have in mind, again, I'm thinking about someone new that I met yesterday, and she has really bad arthritis. She came to move out here to help her daughter take care of grandkids. And it's just so much is flaring, so much is out of control. And it feels like a moving target because your symptoms are up and down. And the drugs take time to work, and getting on a regimen that's working for you takes so much time to work. So sometimes, and daily life is disrupted. So I think that it goes back to, in those scenarios when you feel like things are a moving target, you can't control sometimes or it takes a while to control what's around you, but you can control how you decide to be.
Yeah.
And that's where it is looking at progress in a different way, and really just having this balance of like having those long-term goals still, of like having the health that you want to, but also looking at what can I do now, and just taking it one step further. And as long as you're moving the needle forward, that there is progress being had, even if it's at a different pace than what you had initially wanted to. And I think it's just about strategies and coping with not with that there is a moving target, not necessarily that, oh, we want to like cure it and make it go back to normal.
Right.
Like then that creates frustration.
Yeah. Yeah, I love that. And I'm curious, in particular, from an educational perspective, you talk a lot about patients feeling powerless. I'd love to hear from your perspective. What are some particular ways to regain a sense of control that you can share, that you've kind of shared with your patients in the past?
Yeah, and I think that I learned from my patients. I think that really asking about how are you coping,
Yeah.
and what is working for you. And I think that I learn and I share, like I just had a conversation with a patient of mine who's actually has a rare autoinflammatory disease,
Oh,
was an attorney, needed to it totally derailed her original plans of how she was just this very type A, high performing individual. And again, it was like her symptoms, the fatigue was just, she couldn't keep up with like the pace of
yeah.
80-hour weeks. um and so I asked her again on that scenario where things just felt out of control. And this is like maybe 10 years ago. How did you navigate through that? And she shared with me that it is just being kind to yourself and sort of
Oh,
leaning into
yeah.
that it's not, and sort of being at peace with finding peace and acceptance of, okay, like there's a lot of things that are out of control,
Yeah.
but focus on what you can control. And and I think that, in the just talking about fatigue, because I was talking to her about that, is that it's allowed her, knowing that her energy is finite in this way, has actually allowed her to prioritize what's important for her, right? Of like
Yeah.
just life of, okay, I want to go play with my kids. If I
Right.
want energy to do that, maybe I'm going to Instacart my groceries because it's like exhausting for me to go to the
Yeah.
grocery store, and the cold like aggravates my arthritis, and I won't make it to play with my kids if I'm like trying to do everything. Um, so I think it's just being uh, like really looking at what are your goals, and not trying to fix everything and control everything. I
Yeah.
think it's just sort of being kind to your body and just seeing, okay, but there's things that I can do. And that it takes a total shift in mindset.
Yep.
But I think that that shift in mindset does not have to be like a negative. I think that in that conversation with her, it's like she's probably happier. She is happier now, even though she has autoimmune disease, she has chronic fatigue, she's on biologic drugs, because it's given her the ability to like truly pick like and focus on what brings her happiness and what is most important for her.
Yeah. I'm smiling because I have a girlfriend. I was literally just having this conversation with one of my dear friends yesterday, and she's going into surgery next week. And she is, I mean, she's a mom of three kids. They're all adopted. She works full time. Her husband's a teacher, so he's never home. And she said to me on the phone, she's like, Katie, I am not gonna work for the next 4 weeks. And she's like, this is, I can't even tell you
Mhm.
how difficult this is for me, to actually admit that I'm supposed to be doing as a mom and a woman all of these things, and I have to take care of myself. It's so hard. It's so hard to get into that mentality. Such an emotional toll.
It's hard. It's hard, but but I think that, it is that's what's needed to stay in a healthy mindset
Yeah.
and just take care of oneself. I think that I
Mhm.
see so many people that feel like, again, 2 days ago I saw someone that like people have to power through and suffer. And it's
No.
like you could take something if you're
Yeah.
like you don't need to suffer, you need to take care of yourself.
Yeah.
And I think it is just on that wavelength too of it is self-care, physically, mentally. You deserve it.
Yeah.
Hmm.
I told her, give yourself that gift, and it shows courage that you're taking care of yourself. So
Hmm.
Yeah, this is
Yeah.
an excellent segue into a topic which you've already addressed to an extent, which is when to seek help.
Mhm.
Kind of a decision framework, if you will, for looking for medical consultation. If you could help by providing some guidelines to when women should contact their healthcare provider, um, and talk about the barriers that women face when seeking care, that
Hmm.
would be really helpful.
Yeah, I think that number one, that sometimes people are women, sometimes we're worried. I don't want to come across as I'm being negative or complaining
Mm.
or going in, and that but that's like those are your symptoms, and that's it's disrupt if especially if it's disrupting you enough that you're thinking about, okay, like I should probably talk to somebody. Um, Own it. Those are your symptoms, and don't worry about that. Oh, I'm coming across as like negative or however it is. That's what your doctor needs to hear. Because if you're making it seem like, oh, I'm fine, everything's okay, then how would they know how to help
Yeah.
you? And you have to paint the accurate picture. And if the accurate picture is that, yeah, things really suck, and I'm really having a hard time and I'm really, this is a struggle. It's okay to, paint that clear, transparent picture. I think number one. But to directly answer your question, and I mentioned that first because I think that's so important. But to directly answer your question, and specifically with musculoskeletal symptoms, any symptom that is persistent that
Mm.
you're having, persistent joint pain, persistent joint stiffness, persistent joint swelling, that chronic nature of symptoms, that you should get that evaluated, and it's better to know early so you can be on the right treatment. A big red flag for me when I have conversations with people trying to gauge the severity of their symptoms is it disrupting you from your sleep regularly at night?
Mm.
That is so, so, so important. So if you're noticing that the pain or symptoms wake you up regularly from sleep at night, you're not sleeping regularly, um, that has to get addressed. And so I had someone again earlier this week that had she had a hip bursitis, again, not autoimmune, but severely disrupted her sleep. And she was very uncomfortable in taking something a little bit stronger for her pain for sleep. She's very sensitive to nonsteroidal medications. We had kind of limited options for what to take. Tylenol arthritis wasn't really doing anything for her. And she was terrified. Okay, I don't want to take hydrocodone, which
Yeah.
is I respect and I'm on that same page, wavelength. Um, But when you are not sleeping on a consistent basis, this is weeks on end, her symptoms, you're going to have other symptoms and it's going to affect you during the day. So I think that, yeah, I said, okay, if you need to take something stronger, take something before bed so you can sleep. And so I think that that's another red flag. And then the other item, especially going back to persistent symptoms, especially if it's affecting your lower extremities, if it's like knee or hip, back, if it's going on and you're not addressing it and you're not seeking help, then it's going to affect the way that you're walking. And
Mm,
there's this domino effect that I see every single day. We
mm.
call it referred pain in medicine, where if you have like back pain and you're not taking care of it, you can develop hip or knee or even
Yeah.
leg pains
Yep.
just because of the issue with the gait. So yeah, I think that you know your body best and don't hesitate to reach out so that you can get the right support that you need.
That's great. And one quick follow-up. I love to do this when I go to the doctor, no matter what, really what it is for me or for my kids or my husband, is creating a pain tracking system. So that gives opportunity for us to actually bring the data and the information. Because I think sometimes, even if we're with our partner as an advocate, we forget what's happening. So to your point, it's I think it's important to understand what the pain is, how consistent it is, if we're sleeping, if we're not sleeping, and so on. So yeah, I just wanted to mention that.
Yeah, I think that is excellent. And every person as they're navigating through their symptoms, there's not a right or wrong approach. Um, I think that for some people that might be really helpful in sort of having apps and tracking and being able to provide that and having being able to log the information so that you don't have to keep it in your mind. It's already on, it's logged, you can just present it is it creates white space in the brain so that you can focus on other things.
Right.
But then some people find it overwhelming. And I think
That's a good point.
that for me, like for me to be able to assess health and to come up with a good treatment plan is that it's always nice and I welcome data.
Mhm.
But I also find that just having a conversation,
Mhm.
because you're with your body every day, just talk about whatever you can remember.
Yeah.
And that conversation is, I can get what I need to know in order to be able to provide support and guidance. And
Yeah.
so that it doesn't, and I think it might, I share that to provide reassurance that it's not, you don't have to, if it stresses you out creating the data, then you don't have to do that. You just need to have a trusted doctor that listens and that has time and space to listen to your symptoms.
Such a good point. Yes. That's why you're such an amazing doctor. You treat the symptom. Yeah.
That's great. So this has been wonderful. And I got to take a drink of water because my voice is leaving me after a week of talking. Okay. So that brings us to just some practical takeaways uh, and just actionable advice for listeners. And I know we all have it on our pages right in front of us. So, uh, quick assessment. This is for Dr. Koolaee. Quick assessment, questions that women can ask themselves. I think you've touched on a bunch of them, but if we can reiterate them, that'd be great.
Sure. So questions that like tips, you mean, Todd?
Exactly. Tips, questions that they can ask themselves when they're feeling pain and so forth to make sure that they're taking the next steps that are best.
Yeah, so I think that again to reiterate the symptoms, symptoms that are joint pain that is chronic, that's persistent, where you have a lot of stiffness in the joints in the morning. I think that that really is important to call your doctor to make sure that there's a plan to address that so that you understand the why. Um, that's number one. Number two, I think is important, just a general tip in terms of staying moving and active.
Mm,
Regardless of, it doesn't have to be, nothing has to be perfect for there to be progress. I think it's just
mm,
having that concept and that consistency of I'm going to just make an effort every day or have a routine where I'm moving my body. I think that that particularly is helpful for joint health. Um, and I think also just trusting yourself and knowing that you know your body best and listening to your body and your cues and that if there's something that doesn't feel right, don't sit and marinate in those thoughts. I think it is really just to speak up and start with whether it's your primary care doctor or your rheumatologist. I think it's making sure that your needs are addressed and that you have the right setup and support for yourself.
Well, that's great. Well, that certainly taps into your top three recommendations for joint pain management. Um,
Mhm.
there's so let's finish it up with resources. So what are I mean, I know one resource that I always talk about, but I'm sure there are many out there. One called Journal My Health,
mm.
um,
Mhm.
which is a wonderful resource for tracking and managing health. Are there certain resources that you share with patients to track their pain or their management, or is it simply just writing it on pieces of paper?
Yeah, I think that I really I really look at each person individually and I find that people's are trying to juggle just normal daily life and responsibility in addition to taking care of their health. And I think that it's um, I try not to create more stress for them and like, okay, again, you need to have this journal, log this. But I do encourage, hey, if you can just keep some notes, and even just on your notes page on your phone, is just put some important notes, anything that can help you in tracking. I think that I try and I'm a little more easygoing in that way. And so because of what I mentioned as far as like I'm in just our general conversation together, I can really kind of get a sense of what's the level of symptoms, what's the right treatment and targeting. So I think that's my general approach. I think the American College of Rheumatology provides amazing resources. And obviously there's so much online and so many ways to get information, but I try and actually print out information from the American College of Rheumatology,
Mm.
and I handwrite notes for people in the office of things that I'm sharing. Um, and so, but there's so many pain tracking platforms out there. And I think that is an excellent resource. Everybody's different and everyone, it's is driven differently. I had an engineer patient years ago, and they're very data driven as engineers, and he just made like a Excel spreadsheet for me, and he would like make his like 0 to 10 pain score, the days, the details. And I would look at it. He printed out, he brings it for me. I highlight it, I look at it, I study it. But I think that helped him also in navigating through his symptoms because he was very data driven.
Yeah, that's such a good point, and it's making me wonder. Some of us, me included, will go down the Google train and then the
Mhm.
rabbit hole, and then keep going and going and going. So I love what you're saying. Don't put an extra thing on top of your pain and what your experiences are, if that's not a right approach for you.
Yeah, and to pivot, there's a friend of mine who is a physician. She has MS, and it's advancing. And she has great care. She's at a university setting. She has her doctors, and this is where she's a type of person that she's like, I don't really want to know all the details
Yeah.
and be on Google and be in PubMed and look at every clinical trial. And she's a physician, so she would understand all of the data
Right.
there. She's like, I just want to live my life. And
Mm,
I just, and so I think that that's a really important point is that, yes, people like want to do their best and you should do your best to advocate and take care of yourself. But there's also a balance of like, how much is like, okay, I'm going to know as much as I want to know. And then
right.
the rest of it, like, yeah, she's like, I want to join you for coffee. I don't want to think about, I don't want to, I want to like get a break from, that part and
Yeah.
just
Yeah.
enjoy your company. I want to go to here and like hang out with my kids. And like, so there's like a part of that too, where it is like being normal, whatever that,
Yeah.
however one
Right.
defines that. Um, I think that's really important. It really is. And again, every human's different, but I think that you don't always want to be thinking about like your health stuff. You need a
Right.
break.
Absolutely. This has been a wonderful conversation. We dove into a number of different topics related to why somebody's joints might be achy. I mean, we looked at the pain puzzle, that not every ache equals inflammatory disease activity, but how to identify, or what steps to take next, because as we know, it's a moving target, and that can be a challenge. So thank you so much, Dr. Koolaee, for always spending the time with us. This has been really wonderful and helpful. It helps us as we are bringing this Women in Rheumatic Health Invisible Battles series to the public. And I'm sure I speak for all of us when we encourage listeners, we encourage the caregivers to encourage their loved ones who may be fighting a battle, to share their experiences and ask questions. And you're certainly welcome to contact any of us related to those, but certainly contact your healthcare providers as well. Any final thoughts from either of you?
I just want to say thank you, Todd and Katie, for just creating this space where we can talk about these topics, which are really important. So I really appreciate the opportunity.
Absolutely. Katie?
No, I think this has been great. I guess I can tee up the next episode, Todd, if you want me to.
Sure.
And I think it's a great transition. We will be talking about fatigue. And we talked about sleep and the importance of that a little bit in this podcast already. But fatigue, why it's more than just being tired and how to manage it alongside chronic pain.
A great topic that certainly covers a wide swath of autoimmune issues, rheumatic health. So thanks again, Dr. Koolaee and Katie. And we wish everybody, as always, best of health. We'll see you next time.